A Nursing Theory, Florence Nightingale by Morgan Reed, Austin Black, and Ashley Reddle. As a young woman, Nightingale wished for meaningful work and began to imagine herself caring for others, and by the age of 17, she decided to find a way to serve mankind. By the age of 25, she had identified nursing as the means to fulfill this calling. When she was 30 years old, she was permitted 2 brief periods of instruction in nursing at an institution in Germany. This experience helped her to understand the essential components of basic nursing, hospital design, and personal administration. In 1852, Nightingale was offered the superintendent position of a small hospital in London. As Nightingale was preparing to leave this position, she was appointed by the Victorian government to lead a group of 38 women to Ottoman Turkey to provide nursing care for British soldiers fighting the Crimean War. Her establishment of the Nightingale School in London in 1860 and the distribution of trained nurses abroad established the basis for nursing education worldwide. Nightingale remained actively concerned with the development and behavior of the Nightingale nurses educated at the school until her death in 1910. Between 1872 and 1900, she wrote a series of 13 letters to the Nightingale nurses that both documented the progress nursing made in the late 19th century and warned nurses that they must remain current, competent, and caring. Nightingale's environmental theory. During the Crimean War, she observed a correlation between the patients who died and their environmental conditions. As a result of her observations, the environmental theory of nursing was born. Nightingale explained this theory in her book, Notes on Nursing: What It Is, What It Is Not. The environmental theory of nursing is a patient care theory. That is, it focuses on the care of the patient rather than the nursing process, the relationship between patient and nurse, or the individual nurse. In this way, the model must be adapted to fit the needs of individual patients. The environmental factors affect different patients unique to their situations and illnesses, and the nurse must address these factors on a case-by-case basis in order to make sure the factors are altered in a way that best care for an individual patient and his or her needs. According to Nightingale, nursing is separate from medicine. The goal of nursing is to put the patient in the best possible condition in order for nature to act. Nursing is the activities that promote health, which occur in any caregiving situation. Health is not only to be well, but to be able to use well every power we have. 10 major concepts under the environmental theory include ventilation and warming, light and noise, cleanliness of the area, health of houses, bed or bedding, personal cleanliness, variety, offering hope and advice, food, and observation. Her observations taught her that unsanitary environments contribute greatly to ill health and that the environment can be altered in order to improve conditions for a patient and allow healing to occur. The article we used was titled Hospital Lighting and Its Associations with Sleep, Mood, and Pain in Medical Inpatients by Bernhofer, Higgins, Daly, Brandt, and Hornick. The article took a look at light exposure, sleep-wake patterns, mood, pain, and their relationships. The importance of circadian rhythms to human health should not be overestimated. A good night's rest and exposure to sunlight are associated with better overall health, and measuring the influence of the 24-hour light-dark cycle on health outcomes has recently been the subject of studies. Nightingale proposed that sunlight is critical to healing of the body. Light exposure can be manipulated by nurses, whether that's turning the lights on or off, or closing the blinds or opening the blinds if there's a window in the room. This study used 40 participants over a 12-month period. It looked at how light exposure affected sleep, mood, and pain. Sleep was observed using watches that measured light exposure and rest activity patterns. A survey on mood was given each morning. and patients rated their pain subjectively using the numeric scale from 0 to 10. Looking at the results of the article, the brightest hospital lighting was not enough exposure. Average hospital light has 104 to 8 lux. Lux is what light is measured in. Average home light exposure was 150 to 250 lux. On an average sunny day outside, it's 100,000 lux. A person needs a minimum of 1500 lux 15 minutes a day, or 4000 lux 8 hours a day. That's necessary for their circadian rhythm. Light exposure was found minimal. Sleep was short and fragmented among patients during this study. Less than 50% slept during nighttime hours due to light and interruptions by staff. The mood surveys reported tension, anger, depression, and fatigue. Pain ratings still remained moderate to high. Nurses have many techniques to help with sleep, mood, and pain, whether that's with pain medicine, sitting down to have a conversation, or just listening to the patient when they're angry, or turning off the lights and shutting the door for noise when it gets loud. How the article utilizes the theory. Nightingale expressed the importance of light in healing. The study looked at how much light patients were receiving during their stay. The light amount was shown less than what is adequately needed. Sleep, pain, and mood were not at their optimum level. They used what Nightingale proposed in her environmental theory from the 1800s to be true to healing. Looking at how it's related to my clinical practice. I work in the neurotrauma ICU. In the ICU, there are constantly alarms going off. We have patients who are confused and seriously injured, and it's brightly lit during the day. I work overnight, 7 p.m. to 7 a.m., so at night we try to keep the lights off as much as possible, and we also cluster our care so there are less interruptions during a patient's sleep. Each patient has pain medication prescribed usually. We always treat subjectively to what they say their pain is, or using the FLAC scale if they're intubated and unable to communicate with us. Patients are always given the opportunity to tell us how they are feeling. Surveys are sent out for patients and families after being discharged, reflecting on their stay.
First metaparadigm discussed is going to be person. This is based on the research article Hospital Lighting and its association with sleep, mood, and pain in medical inpatients. And it was done by Bernhofer, Higgins, Daly, Brandt, and Hornick. Nightingale said people are multidimensional, composed of biological, psychological, social, and spiritual components. Inclusion material for this study, patients had to be an adult, so 18 or older, and an inpatient. They were in moderate to severe pain. Their length of stay was expected to be above 72 hours, and they hadn't had surgery in the past 4 weeks. Patients excluded were those not alert and oriented times 4, and their length of stay was below 72 hours. The study did include African American and Caucasian participants. Both female and male clients participated, 23 female, 17 male. Next discussed is health. Rogers said health is what the patient says it is. Nurses need to know what that definition is for each person. So the research article used patient subjective pain scores. They used the numeric pain scale 0 to 10, 0 no pain, 10 being the worst ever. Data separated these pain scores in relation to the time of day, so they looked at daytime pain scale reports versus night. They also measured mood disturbances by using the PALMS questionnaire, looked at tension, anger, fatigue, confusion, and other mood disturbances. They compared sleep-wake patterns between night and day. It did show interrupted sleep, and there were similar day and night sleep amounts. There was a variety of admitting diagnoses such as digestive, respiratory, infectious, spine, brain, head, urinary, endocrine, and wound. The next metaparadigm discussed is nursing. So Nightingale said nursing is to alter or manage the environment to implement the natural laws of health. Nurses are responsible for pain management along with doctors' orders. So use of pain medications such as opioids. These were converted to oral dosages for the study. Patients reported moderate to severe pain, so above a 5 on the 0 to 10 scale. Nurses could also adjust lighting, so brighter lights during the day and dimmer during the night hours was suggested. Overall, patients experienced dimmer lighting throughout their entire stay though. So nurses could cluster care to allow for minimal sleep interruptions, especially at nighttime. Rest activity patterns did show little circadian synchronization. So the next metaparadigm discussed is environment. Nightingale said environment is everything outside the person. Medical inpatient study of light exposure. They looked at this in relation to sleep-wake patterns, mood and pain. Patients wore a wrist actigraph for 72 hours to measure the amount of light that they were receiving per day. So this wristwatch was worn on the non-dominant wrist. It was described as non-constraining, and the patients were instructed to keep this watch exposed and facing upwards so that it would be the most real amount of light that they were experiencing. So the patients that wore these wrist actigraphs were either on the window side of the room in a semi-private, or they were in a private room. Clients were also recruited 24 hours after they were admitted to the hospital. This allowed for acclimation to the hospital routine before diving them into a research study. So hospital lighting is currently at low levels despite supporting evidence that adequate light promotes healing. So nurses assume subdued lighting promotes patients' rest and sleep. They currently initiate dim lighting throughout the day hours to promote rest. And the study based its theory that low overall lighting actually impairs a patient's rest and healing. And lighting should be adjusted to promote circadian rhythmicity. So this article is saying that patients should receive light during the day and then dimmer light at night so that normal sleep-wake patterns are initiated to promote healing, because sleep-wake patterns are highly associated with mood disturbances and pain. So background on this, Nightingale suggests that sunlight promotes healing and recovery in the person. Circadian rhythm is the body's 24-hour clock, and it responds to various things like stimuli and hormones. Hospital lighting is extremely low worldwide at 50 to 100 lux. So Rose and Ross say disturbances in sleep-wake rhythms are known to have negative cognitive, psychological, and physical consequences. And the research shows that how light affects well-being, but little research has been done on lighting in acute medical inpatients. So in relation to my clinical practice, emergency departments are usually loud, busy, and bright. My shift is from 7 a.m. to 7 p.m., so the use of brighter lights during the day and then dim lighting at night. I could close doors to decrease noise stimuli but keep the lights on. Adequate pain management, so use of opioids, sedatives, analgesics, NSAIDs as prescribed, and then increased maximum comfort and stretchers. They're not usually very comfortable, so give patients pillows and blankets and turn them as necessary. I could also allow for patient reflection, ask them about their pain control, and encourage them to talk about their mood and feelings. So sometimes patients are in pain for multiple days. So the first time that they get pain relief in the emergency department, they're more inclined to rest. So though rest and sleep are important to healing, it may not be the ER's primary focus. So our primary focus is going to be to stabilize the patient so that then they can go to an inpatient room and they can heal from there. So like less acute diseases such as a migraine in the ER, we're going to give them pain medications, fluids, stuff like Toradol, try and get their migraine under control, allow them to rest, maybe dim the lighting, and then enable them to go home and recover from there more. But a lot of times we promote rest and healing so that then they can go home, they don't have to be admitted. And I could also complete my orders before the end of the shift to allow rest and healing during the night shift.
Florence Nightingale's philosophical background is based on her holistic approach to nursing. She believed that environmental adaptation is the basis of providing holistic care. According to Nightingale, people are complex, holistic beings, and the goal of nursing is to foster health and adapt care based on each individual patient. She also believed that nursing is achieved through putting patients in the best condition for nature to act on them. This includes nursing interventions such as reducing noise and anxiety, promoting sleep, etc. Nightingale's nursing philosophy was also strongly based on her spirituality. Her devotion toward God and her belief of spirituality was the foundation of almost all that she did as a nurse and for the nursing profession. She was also a strong advocate of egalitarian human rights, which is the belief that nursing should not be limited by gender, class, beliefs, or values. Environmental theory and other clinical practice areas. Many of Nightingale's implications of the importance of a clean environment, derived from her experience in nursing, have been substantiated by public health researchers, occupational health professionals, and industrial hygienists. Principles of Nightingale's environmental theory are utilized in a variety of clinical practice areas. The article Clinical Application of Nightingale Theory provides an example of this theory being applied to other areas such as the patient home. The article recommends the importance of teaching when patients are being discharged from the hospital to go home with caregivers. Teaching should include maintaining a clean environment and brighter lighting during the day, and the importance of proper ventilation within the home. These interventions may prevent infection and promote an overall well-being in the patient. Florence Nightingale's environmental theory. This is a visual of some of the environmental factors that must be in balance, according to Nightingale. She suggested that what nursing has to do is put the patient in the best condition for nature to act upon him. If any of these factors are out of balance, it may hinder the healing process. Now, as you can see, light is one of these components, which goes along with our original article that looked at hospital lighting and its association with sleep, mood, and pain in the inpatient setting. So all of these components are interrelated. The environmental theory is definitely utilized in my clinical practice. I work in the burn unit, which is a unique mix of critical and step-down patients. We also see pediatric patients in our triage area prior to them being admitted to the PICU or the pediatric floor. So we see a broad variety of patient ages and acuity levels. I work the night shift from 7 p.m. to 7 a.m. So we definitely have to adapt the environment in order to promote rest at night. So we do things such as turning the lights down and reducing the noise level, and then we cluster our care. We also have closed visiting hours after 9 to promote infection control and rest. And then pain and anxiety control are also major factors. Pain control is a major factor in burn patients, so we assess pain frequently utilizing pain scales that are specific to the patient. We administer a variety of oral and IV analgesics, and for our more severe burn patients on the ventilator, they typically have continuous infusion for pain control. And like I was saying before, anxiety is a huge factor in burn patients. So we typically give benzodiazepines in conjunction with the analgesics to help with the anxiety levels. Distraction is also beneficial in the pediatric population during dressing changes. And then just other things such as changing linens out and keeping linens dry and clean to promote comfort. And then we allow for patient reflection during shift change by doing bedside rounding, which encourages the patients to discuss any concerns they have with both shifts of nurses. Surveys are also sent out in the mail following hospital discharge, which allows the patient to provide feedback. In conclusion, Florence Nightingale was the first nursing theorist that laid the foundation for modern nursing practices with her environmental nursing theory. Nightingale suggested that sunlight promotes healing and recovery in the person. This theory was applied to the study hospital lighting and its association with sleep, mood, and pain in medical inpatients. It was conducted in order to determine the effect that lighting has on patients in the hospital. The results correlated with Nightingale's environmental theory that brighter lighting may promote the body's natural circadian rhythm. Principles of Nightingale's environmental theory remain timeless in the world of nursing.